I am Ramaswamy Govindan, a medical oncologist specialized in treating patients with lung cancer. I'm a professor of medicine at the Washington University School of Medicine, Alvin J. Siteman Cancer Center. I think this is a very, very important question. I just want to take a few minutes to explain this very carefully. I always tell my patients that we doctors are very good in predicting how a group of patients would do. We doctors are very bad in predicting how long Mrs. Jones would live, Mr. Smith will live. I've had patients with stage 4 lung cancer. I've taken care of mother and daughter. I've taken care of father and daughters. And they do two different, they behave in two different ways. And it is very hard to predict that. So I think that's very, very important. Unfortunately, sometimes the healthcare professionals go and tell patients that if you take this treatment, you will live 6 months. If you don't do anything, you'll live 3 months, and things like that. And I think that is quite misleading. And I clarify this when I discuss this with our patients. I tell them that these numbers come from looking at the average number from papers that many of us write and publish. So I think what I think is helpful, and what I tell my patients is that if you have a stage 4 lung cancer, let's say metastatic lung adenocarcinoma, how many patients make it to 1 year? Let's say you have 100 patients today. A year later, you come back, and how many make it to 1 year? Let's say it's 2/3. 2 years, maybe half. 3 years, let's say a third. So I tell our patients that about 2/3 make it to 1 year, about half make it to 2 years, and about a third make it to 3 years. And I've also learned to explain this carefully in saying that it does not mean that you have 1 year or 2 years or 3 years. It's very hard to predict whether you'll be in the group that's still keep going strong after 3 years, or you will be in a group that doesn't even make it to 1 year. So it's a little hard to say. Although as time goes along, depending on how well patients respond or not respond, you get a sense and you can direct them. And as the disease advances, you can get to be a little bit more accurate whether patients have weeks, days, weeks, months to live. In terms of the general question today in 2020, what's the survival for patients with metastatic stage 4 lung cancer? To me, that answer is dependent on the type of lung cancer we have. For example, the ALK-positive lung cancer. We are now beginning to see patients who live 5 years, who live 7 years, and 10 years increasingly. So that's a different group than the group of patients who don't have EGFR, ALK, or ROS alterations. If you take the so-called triple negative or the wild type EGFR, ROS, or ALK, and if you look at the chemoimmunotherapy studies, roughly speaking, I would say about 2/3 make it to 1 year, about a little less than half make it to 2 years, and about 25 to 30% make it to 3 years. Those numbers would change, and of course, with more and more advances that are happening. So to a great extent, it depends on not only the type of gene mutation the tumor cells have, the extent of the disease, and the general performance status, comorbid conditions. So it's a very complex situation, or it is not an easy question to answer in a very generic way. I think it's also important to appreciate that patients do take the doctor's words seriously here. And when somebody goes and says, you got 1 year if you take this treatment, they literally start counting the time. I think we're doing a great disservice by giving that information. Even though well-intentioned, sincere, I think it can be quite misleading. So my message is, it's very hard to predict accurately how long anybody would live. Number two, it depends on various factors. It depends on the tumor gene alterations, key founding clone alterations like EGFR, ALK, ROS, and the presence of other alterations. For example, EGFR mutation with, let's say, P53 mutation. Those groups tend to do a little worse compared to those without the P53 mutations. And then the presence or absence of comorbid conditions. Somebody with a terrible heart disease or a poor renal function may not do as well as somebody who is fit and strong. And also the disease burden of presentation probably matters a lot too. Extensive bony metastasis, extensive brain metastasis, both do not tend to confer good prognosis. So I think we have to keep those things in mind.